Okay, thank you, Mr. Chairman, and thank you, Ranking Members Police, and all those who are briefing the subcommittee today. We appreciate your attendance and your testimony. In many parts of the country, including much of Missouri, where I'm from, the effects of the economic downturn caused by blanket shutdowns have been just as, if not more, damaging to human health and safety than the virus itself. Just to give you perspective, I speak regularly to a funeral director based in my district. During this pandemic, he has seen more deaths related to suicide than from COVID-19. Scientists have repeatedly found that unemployment leads directly to things like substance abuse, depression, child abuse, domestic abuse, violent crime, and suicide. A study performed by the University of Zurich found that 1 in 5 suicides are related to unemployment. That same study showed in 2009 the suicide rates jumped 12% due to the economic crash of 2008. Additional studies that we've discussed in this subcommittee have found that for every $17 million Americans lose in collective income, we lose an American life. That translates to 65,000 American lives lost each month due to the economic shutdown. Roughly, that's 50% more lives lost than due to the coronavirus. I don't want to minimize the devastating impact the virus has had on many American families. It is important that we look at, but I believe it's important we look at the whole healthcare picture and how many Americans have also been impacted by the forced shutdown of businesses across the country. With the curve flattening and all 50 states open in some capacity, it's time we focus on getting our economy back on track. Excuse me, and we're fortunately headed in that right direction. Now, I would like to address a question to Ms. Gressler. One of the things that everybody's talking about through this situation is we need to make these decisions based on data and based on science. I just gave you some statistics a minute ago with regards to data, 65,000 deaths per month. On the other side, the rest of our healthcare concerns with the rest of our society. The CDC and Dr. Fauci both now believe we need to be opening up. The CDC indicates that our death rate on the coronavirus is less than 0.4%, which is right in the area of the common flu that we get all the time. Last week in our hearing, one of the gentlemen that testified indicated that children now are greater risk with the flu than they are of COVID, and the lockdown costs our economy over $25 billion per day. One of the things also that came out that I've read recently here in one of the journals is that the University of Pittsburgh came out with a study that said that the virus is now mutating to a less virulent strain. There's 2 separate doctors in Italy that now say that they recognize that the strain is much less virulent than it was. And anecdotally, in the same article, there was a statement that New York also sees this happening as well. We now know that the disease is very targeted. We see this for seniors and high risk individuals. So we have lots and lots of data. I could continue on, or I've got reams of it in front of me, but we have the data, we have the scientific evidence, and the scientists who tell us now where we can do this responsibly. Why do you think there's a bunch of states that are very, very slow at reopening when the data shows that we need to be reopened for the healthcare of the rest of our society and that we can do it responsibly? Why do you think those states are not doing that?
Yeah, I think that there's a lot of fear about what the consequences will be, but those aren't acknowledging the non-COVID health-related consequences, things talking about children not having great access to school. And saving lives and livelihoods go hand in hand, just as you pointed out here. And as we look forward, there's absolutely no reason why childcare centers and schools should not be reopening when we know now that the risks to children are actually less than the seasonal flu. There are ways to provide, a more data-driven and surgical approach to reopening things than to just keep these shutdowns in place longer term, as we really are taking away people's livelihoods. Because the longer that you have a business closed, the more likely it is they're never going to be able to reopen their doors.
One more quick question, your comment here. I just got off a conference call earlier before this meeting with Larry Kudlow, National Economic Director, and he made the comment that housing is strong the last month. Travel is up, new business apps are up, existing business, 80% of them now are up and running. And so his comment was, it's important that we don't put any sort of policy barriers in place to stop this recovery that we're in. What do you see as a policy barrier that we should not implement to make sure we continue along the line of a recovery?
Well, I think that there shouldn't be barriers that keep businesses unnecessarily closed for longer, that keep schools closed longer, and we absolutely need to put some liability protections in place so that these smaller businesses, have the assurance that if they reopen and they have their workers come back, they're not going to be sued for things that are really none of their own doing.